Welcome to More Than Miles, the podcast where we use storytelling and expert interviews to widen the lens on what it means to be a happy and healthy endurance athlete. We believe that athletes are so much more than their body, sport, and training miles. I'm Dr. Kate Edwards.
And I'm Dr. Kacy Sinders. We are endurance athletes, physical therapists, and huge coffee addicts. We spend most of our time treating, educating, and working with endurance athletes. Thank you so much for tuning in today. Now let's get to the show.
Hey everybody, welcome to More Than Miles. Today, Kacy and I are going to talk to you about gait analysis.
We're actually recording this one on Zoom because we are in two different places right now. So very thankful for technology. We can still harass each other while we're talking via Zoom. So don't worry, there'll still be plenty of snark. Kate, how's your morning been?
Whew, it's been pretty good. I'm on my second cup of coffee. We brought Andy to school. I can see the school from my house, so walked him over there. I actually met somebody for coffee, and they had this really great machine. It's way better than mine. So I have an espresso machine with a frother and everything, but the person's house that I went to today is so legit. They actually have their coffee maker or their whatever machine, espresso machine, hooked up to their water line, and it has a filter so that they know exactly like what type of water. It's always consistent. And then they have the special grinder for their coffee beans. And then they push the thing down with the tamper. And it was just incredible. The beans, of course, were made locally, which was really nice too.
That is so bougie, but I'm here for it. Like, if I could have something like that, I would. That's not like an eye roll, like, oh, that's so bougie. That's bougie and I want it.
Well, what happened, unfortunately, is I saw the setup and I took one look at Brian, my husband, and he said, I know, the kitchen redo. I don't think I can afford it, though.
We'll see. There's always room in the budget for coffee, right, Kate?
That's right. What about you? How's your morning been?
It's good. As you know, Tuesdays are my days off from clinic work. I tend to do a lot of work still on Tuesdays, but it's all jumbled together, which is fun for me. I went out to the river and did my workout. It's really nice to be able to do my hardest workout on a day I'm not in the clinic so I can recover and don't have to worry about being on my feet and using my brain all day. Really good workout at the river this morning, although we're still waiting for the fall temperatures here in Atlanta. September in Atlanta is a combination of second summer and fake fall. You just never know how it's going to be by the day. So this morning it was like pretty humid, 70 plus degrees even in the morning. So we're waiting on our fall temperatures. Lovely morning nonetheless. Just trying to keep my dog from burying his bone in my bed all morning as well.
I'm in New York right now. I'm wearing a sweater and shorts, and I was cold outside. It was 55 degrees this morning. And it was very lovely. So we have the good weather, and I'll be in Atlanta next week. So I have to make sure that my wardrobe is packed accordingly.
Well, you never know what you're going to get down here. So bring a little bit of everything.
I should have left. I didn't leave a lot of clothes in my closet. I should have done that.
Yeah, well.
I will. All right. So anyway, let's talk a little bit about gait analysis, since that's what we said we were going to talk about today. So gait analysis is something that Kacy and I do, and everybody in our clinic at Precision Performance does on a regular basis. I'd say almost every single day. And we have a pretty good system down of how we're doing it, what people should expect and all that. So it's a question we get a lot. What is gait analysis? Why do we do it? What's the importance of it? And it's something that's actually, if you were to look at our Google Analytics, people look up quite often. So let's talk about first what a gait analysis is.
Yeah, so I think we all use this as sort of the cornerstone of our treatment, right? Because when we are treating runners, we need to see them run to really see what's happening, why they're getting injured, why they're having their performance plateau, whatever it may be. A gait analysis for us is usually done on the treadmill, but we can do it outside. So we watch a runner run, as you would think. We used an iPad or some software, which we'll get into in a little bit, to video from the side and from the back. And we're looking from either top down or bottom up. We're looking at the entire runner as they're running. And this is an important distinction we want to make, because when you go to, say, a specialty running store, those people are really knowledgeable in the shoe technology and the different types of shoes, what may be good for you as a runner based on what you tell them, like what your goals are, what kind of shoe you like. but they're usually just looking at your foot. Sometimes it's only walking. I know some stores will put you on a treadmill, but there's a few things you can see with walking. But to get this whole picture, especially when you're coming in with maybe a complex injury or a chronic injury, having someone who's really trained in biomechanics is important.
Yeah, and I think that what we really need to focus on here is that we're talking about an analysis. An analysis is an in-depth thing. So it's something where we actually look at you in multiple ways. We break it down biomechanically. We'll look at, what's happening at the foot, the knee, the hip, the trunk, the arm swing, all the way up to your head. So sometimes what happens at your head impacts your landing. Sometimes what happens at your foot impacts your opposite arm. And so it's really important that whoever is doing your gait analysis, it doesn't necessarily have to be a PT. It can be a PT, it could be a coach, it could be an exercise physiologist, but it should be someone that truly understands what the biomechanics are of running. And they need to know more than like 3 key things. Like a lot of people that do a gait analysis will say, okay, you're pronating, or your knee is in valgus or diving in, and you have hip drop. Well, all those 3 things are really important, and we need to note those. That's really just the skimming the surface of what's really happening in a gait analysis.
Right. And those 3 things that you talked about could be happening for a multitude of reasons, right? So I think that's the benefit of having a professional to help guide you through this, not only to give you the information and to show you, hey, this is what you're doing while you're running, but what do you do with that information? What is relevant to you as a runner? How does it relate to your injury? And getting that next step, I think, is having someone who's really skilled in analysis is very valuable.
Yeah, and it takes a long time. So I don't know if you remember the process, but it's not something you can learn in 1 or 2 sessions. It's not something you can learn even, I'd say, in a couple months. This is something that the better you get at gait analysis and understanding biomechanics and how the body moves, it's years. So I've been doing this for
a long time.
I mean, more than 10 years for sure. Now, you can walk by and you can hear the differences. So it's simple things like I can hear when somebody is not hitting the ground correctly, or I can hear when the right side of their body is doing something different than the left. I can walk by and glance and say, oh God, there's thoracic spine mobility is total issue there. Or, you know what I mean? And so it really takes a lot of reps. So if you're getting a gait analysis, you want somebody who has those reps, who really has seen a lot of people move and really gone through a lot of videos. I mean, at our clinic, we go through videos all the time. And so not only are we recording every single day and looking at runners, we're also sharing the videos amongst each other and learning from them and saying, hey, have you ever seen this before? Or look, I saw something different. Or, oh, look, this is the pattern that I've seen over and over again. And by the way, I've noticed that every time I see this, this is a diagnosis that comes with it. So I think that kind of seasoned approach and that, seeing several reps of the same thing is what's really useful and helpful when you actually get a gait analysis.
Yes, Kate, I do remember the process, and I do remember how long it took for me to grasp these things. And, it helps to be a runner because I can feel it. I see it. So I had a lot of experience, but I needed to tie that to the knowledge part. Right. And so I did have a little bit of an advantage there. But something I talk about with my patients and how I approach gait analysis is, I'm sure we're going to say this several times over the course of this conversation, but there is no perfect run gait, right? There's no one way to run. There's no ideal. I mean, maybe we have some boundaries, guidelines, guideposts that we look at, but our job is really to figure out what is happening when this runner is running and is it a problem? That's what I always tell people, because runners, they want to impress you. They want to impress themselves. They want to look good while running. And so when we're there pointing out all these things that's going on, I don't want them to get bogged down by the negative things or the things that I say are quote unquote wrong or maybe not ideal. So always tying back and making it, funneling it into what does this mean for you? And what does this mean for us as a physical therapist and patient partnership? And where do we go from here? Understanding that we're going to talk about some major things we look at, but there is no one perfect running gait.
And I think that's a really important point that you brought up, because we will see a lot of things. And just because we see it doesn't mean that it matters. In the beginning, I used to tell everybody everything, and I'd be just so excited to find all this stuff. And then what I found was people would think there was something really wrong with them and that their run gait was awful. And then they would take that and hold that close And that became a bigger problem than anything. So you don't always need to know every single thing that's happening in the run gait. You just need to know what's impacting how you're feeling while you're running, or perhaps that chronic injury or your performance issue. So while we may tell people a lot of things, we don't give them a lot to work on. We usually give them one thing to start and then move forward.
Yeah, trying to keep it as simple as possible, because we want running to be fun and joyful, and it's not fun to think about every single step. And I've had plenty of patients who get really frustrated with that. So I usually am trying to undo some of that and be like, okay, let's focus on one thing, because I don't want you to get too upset while you're running, because this should be fun. I guess we've already hit this a little bit, but why would someone want a gait analysis? So it's not only injury prevention, but it can be some other things. So you want to touch on that a little bit?
Yeah, I think that gait analysis, there's a little bit of research out there that says even if you have nothing wrong, a gait analysis would be helpful because it could improve your performance and improve your function. So you can get a gait analysis because you want to get faster, you want to become more efficient. A common thing I hear is people will say, one side of my body doesn't really feel like the other side. So they'll say, my left side doesn't really match my right side. I can tell that I'm doing something funny. So if you're doing something funny and you kind of want to clear it, because running should actually, like Kacy said, be fun. It shouldn't feel like a lot of work. Yes, it's going to feel like work when you're pushing yourself, but when you're just going out for a run to enjoy like a 5-mile run or whatever it is, it doesn't have to be hard and it doesn't have to be painful. It can be really nice. We are trained to believe that running's supposed to hurt, and it's not. And so a gait analysis is really cool because oftentimes we can show people that, okay, running doesn't have to hurt. It can feel effortless, and it may just take one cue to get you there. Of course, it may take a lot of cues. I don't know, but it could take one cue. So I think performance and just ease of running and joy of running are good reasons for a gait analysis. And then I guess injury prevention falls into that too, because we do know that certain injuries come from repetitive issues, right? So if somebody is constantly running and they're getting in, I'm bringing up knee valgus because it's the most commonly known, and that's where the knee is coming in. If someone's constantly going into that knee valgus position, and then say they decide to train for a marathon and they've added miles really quickly and maybe doesn't manage their schedule very well, they could easily end up with like an IT band or a knee injury. So if we're correcting that beforehand, and then also obviously teaching them how to train properly, which is a huge component of it, then they may not end up with that knee injury. And then the other piece is just coming back from an injury. When someone's been injured or has had multiple injuries over a long period of time, sometimes it comes back to your gait or your biomechanics. And a lot of times it comes back to your gait and your biomechanics. We use it as a diagnostic tool to see, where you're having strength deficits, where are you having mobility issues, and how is your foot impacting the ground, and how is your body absorbing the force. So I think it could be used in any of those situations.
Yeah, for sure. I actually have 2 comments related to that. I've been able to swallow my ego and pride, and I have been doing my own gait analysis on myself about once a month. So I creepily set up the iPad, I run on the treadmill from the front and get a few videos from the front and the back. And not too long.
Hold on. It's totally creepy. And I think it's hilarious. And you never know when you go into our clinic if Kacy's going to be there. Sometimes I wonder if she lives there, by the way. I was there on a Saturday and I was like, the lights are on. I had to go pick something up and there was Kacy working out. And then sometimes she's doing her laundry and other times she's videotaping herself running. You just never know what's going to happen. But I guarantee you, Kacy is in the clinic more than anybody else. I just had to say that because it makes me laugh every time I show up and I'm like, oh, Kacy's here.
I'm here. Yes. Well, I'm utilizing the full benefits, all of my work benefits, which are laundry, exercise equipment.
I don't want people to think that's a real work benefit. Somehow I've agreed to it for you, but I don't want everyone doing their laundry at work.
Now the truth comes out. Okay.
I don't mind you doing it.
I live in a studio apartment. I have no laundry. Okay.
It is a work benefit. There you go. We should have written that in the work benefits column.
It drew me in for sure. For sure.
Ooh. Well, and you have your own personal gym too.
Exactly. It's pretty great. Anyway, so why I bring this up is, so I have chronic left-sided issues. Almost all my pain and injuries are on my left side. So I did my gait analysis one time and I felt fine at the time. I didn't have any problems. And I was like, my right leg's doing something a little bit funny. And I saw that my right hip wasn't extending. And I was like, that's a little weird, but I feel okay. Sure enough, next week, a little bit like hip tightness, hip pain, I felt it. So it just goes to show that you don't have to have an issue right away. We can pick up things by looking at running gait in real time because our bodies change. We're not the same every day. Really, any time is a good time for gait analysis, I think. And you got me so distracted, I forgot about my second point I was going to bring up from that. So we'll just keep moving on.
It'll come back to you.
It'll come back.
Either tonight when you're asleep or a little later in this podcast.
Right. Right.
Yeah. So I think that the next piece that we should touch upon is like what to expect, what happens in a clinic. How does this whole gait analysis work? So the first thing is you can do a gait analysis virtually. So if there are people that really want an expert to do a virtual gait analysis, we can certainly do that. But we also do it in the clinic. Virtually, what we would do is have somebody run outside and make sure that they're being recorded running towards the camera. I'd say you can't get too far away because you can't really see anything, but we need about 10 to 30 seconds coming towards us, also on the side. And I often get videos where people cut off their feet or their head. That's not very useful. We need both. So make sure you're far enough away and follow the person from the side. So it's not just like one screenshot where we can only see one leg landing. And then also we like to look from the back as well. So we usually have people record those videos 10 to 30 seconds without a shirt or in a sports bra so that we can see what's happening in the spine. We take a running history or have them send a running history along with those videos. And we can kind of break it down from there. And then we voice record and talk over the video when we send it back and go through everything that we see and kind of give instructions in terms of maybe some exercises or running drills that we might do. So that's how we would do it virtually. And then, of course, we can have a consult on the phone if we need to.
Yeah, we offer that virtually. So you can go to our website and we'll put it in the show notes if you want us to look at your running gait and get all that lovely information and you're listening to this, then you can totally hop on there and we'd love to help. You know, something to add about that, I guess sometimes people come in and they're like, well, how does this even look like? What does this look like? How does this happen? Right. A lot of this has to do with the running history, honestly. I would say the majority of people, I will have them, run at a pace where most of their training is at. So easy run pace, aerobic run pace, whatever most of their mileage is going to be at, because that's where we're going to accumulate the most stress on the body, right? And so I'd say the majority of people, I have them do that. But sometimes, I treated an 800-meter runner, and so I wasn't going to see what I needed to see on the treadmill. So I'd asked his coach to videotape him during a workout when he was doing more race pace work so I could see what was going on there. So that's just a small example. And then, of course, we see people training for marathons all the time where they get through their weekly runs fairly well, no pain, no issues. And they get to their long run and maybe they start to have pain around mile 12, 14, whatever it may be. And at that point, I might ask them to run before they come in so that we can pick up on what's happening when they fatigue, what's breaking down over time. So putting those two together, the running history and the gait analysis itself, I find is really important. And that's something that I try to hone into when the runner comes into the gait analysis.
I think that the history is, again, if we're talking about running gait analysis as being in depth, is a huge component of it, right? So we often say subjective exam is the most important part of our whole evaluation. Well, the history and what's happened behind your running and like what your goals are and what type of surfaces you run on and what your training is like is really impactful when we're doing a gait analysis. And we do need to know that information because you look very different on a treadmill or outside if you're training for, like Kacy said, 800 meters or a marathon. And having that information really changes how we will engage with you and how we will look at your biomechanics and see what really needs to be addressed.
I guess we should dive in and talk about what we look for. I mean, we've mentioned that there is no perfect running gait or perfect cadence. We're going to get into cadence because I feel like that's a real hot topic among the running community, and we see articles about it all the time. So I thought we would talk about kind of the big things we look for. And Kate, as you said, you've taught me everything I know. So I think I'll have you start and I will add in some color commentary.
Oh my goodness. I haven't taught you everything you know. You're teaching me too, you know. Well, first of all, Cadence is my dog's name because I think cadence is one of the most important things.
There's a lot of research about it too.
That's right. There's a lot of research about cadence. So yes, now I have a dual purpose when I think of the word cadence. My snuggly little Weimaraner who usually has her paws on my back when I'm in my chair trying to work. She's not here right now. I don't let them come in. I know I'm not letting them come in the podcast right now because they've been tackling each other. But anyway, cadence. So cadence is really great because we can use cadence to manipulate gait. So we can change how somebody's foot is hitting the ground every time we manipulate cadence, which is really cool. And there's this idea of 180 steps per minute is the quote ideal cadence. But what we really know is that there is no ideal cadence. And actually what we find in clinic is that most people will come in with 155 to 165 steps per minute. And then sometimes professional runners or elite runners will come in with cadence that's over 180 steps per minute. So that kind of 180 steps was based on an elite runner a long time ago in the early, kind of in the beginning of the research about cadence. And it doesn't necessarily hold true for everybody. So one of the biggest mistakes I find my people are making is that they'll say, oh yeah, I've been working on my gait. I decided to track my cadence and it's 155 steps per minute. And now I'm running 180 steps per minute. Well, if you think about that, that's a huge jump, right? So from 155 to 180, and that actually puts people in the range of possibly getting injured by making such a big change so quickly. And what we really want to do is increase our cadence by only 5 to 10% if we're changing cadence or manipulating it. I, again, wouldn't do that on your own necessarily, because sometimes it's not the answer, but it is a really great way to tap into like how your foot is landing. A lot of times when people land with their foot really far in front of them, they have to overcome something called the braking force. So it's almost like, it looks like on a video, you trying to put your foot on the brake pedal of a car. Like your knee is really straight and your toes are really high and it's your foot's at this thing called an inclination angle, and your knee being really straight, you're stopping yourself, right? And then you have to overcome that. And so if you're putting your foot far out like that, you can increase your cadence and your foot will actually end up underneath you a little bit more. And that'll be a little bit easier for you to accept the force, store the energy, and then come through. And then the other thing is we also know that cadence manipulation can impact glute firing. So it can increase the glute's ability to fire, which is a really nice way when somebody always says they have weak glutes. Well, maybe it's just inhibition. Maybe it's just they're not, it's not working well with the mechanical lever. So using cadence to manipulate that can be really helpful as well. That's a long answer. Maybe you should add some stuff. Oh, maybe you should talk about what cadence is.
Oh, yes, I could do that. So cadence is strides per minute. This is how many times your foot hits the ground per minute. This is right and left foot combined, right? So every time a foot hits the ground, that counts as one stride per minute. This gives us a lot of information of how efficient you are and how you land, like Kate said. Me personally, I have very short legs, so my cadence is 190 without right. Even, but yeah, I know everyone's making fun of how short I am these days. It's fine. Body type impacts this, so longer legs, right? So there's no perfect cadence, but talking about, I think what you were describing, Kate, was like overstriding is what a lot of people hear, like just more of a common word or verbiage you might have heard out there. That's kind of one of the first things that I will talk to with patients, like when we're looking at it. I say, hey, like, I don't really care too much about heel striking, forefoot striking, or midfoot striking. I'm not really looking at how your foot hits the ground. I'm looking more at where does your foot hit the ground in relation to the rest of your body. We call it the center of mass, but really it boils down to how close to your body is your foot. So if it's further out away, you have to overcome more of a braking force. Like you said, the limb is straighter, so you can't absorb force as well. And so it can cause issues. So this is why cadence is probably one of the things that we manipulate most often, not only because it's an easy cue, because we can use a metronome and things like this. There's several apps. If you go to your app store, you can look for, you can just type in metronome and you should get a variety of options. The one I've been using classically is Pro Metronome, and I've been using that since my undergrad intern days, and so I'm used to it. I know that no one likes to listen to constant beeping while they're running. So there's a lot of ways we can incorporate this. What I'll do in the clinic is we'll do some gait training sometimes where I will give them the feedback of the metronome and take it away, give it and take it away so that they can learn how to feel what that new cadence feels like. And, again, we're only going to be changing the cadence, 5 to 10%. We're usually increasing the cadence. I want to make it clear, we're not usually decreasing someone's cadence. Getting that auditory feedback, it does two things, actually. One, it can give you that feedback of how quickly you're moving your feet. But also, I think it's really great for symmetry. So we were talking about earlier, some people will say, my right leg doesn't feel like my left leg, or something feels asymmetrical. And I think having that symmetrical cue of the metronome can sometimes smooth that out, in addition to strengthening and all those things we need to do. And so there's a lot of watches also, I think, that have a metronome, at least app that you can download. I'm probably not the best person to ask because I've never had an issue with cadence, but I know that there are watches that can give you feedback. If not an auditory cue, you can set it on your watch screen to show you what your instantaneous cadence is, and you can use that for feedback as well.
And then there's also the playlist. Once you kind of get that under control, you can listen to different playlists that are built around a particular cadence, which is really nice if you're a music person, but only if you're a music person. So, but cadence is a great way. And that's kind of the basic way. And a lot of people that do gait analysis and gait retraining will use cadence. It's kind of the first thing that people learn. So do know that, it's not always the right tool. What we like to do is we'll check in the clinic. So if we think that we need to increase your cadence, and you said mostly increase, and that's true. Every once in a while it'll be decreased, but not very often. But if we really need to manipulate your cadence, we'll do it right there in the clinic, and we'll record you and we'll look at what that looks like. And sometimes it's not the answer. So if it doesn't feel right, it may not be the answer. And like I said, a lot of people will give that right away, even if it's not the right thing. If it's not the right thing, we don't give it to you, even if it's the easy thing. So I think that that's definitely part of it. So the next thing that we'll look at is head position if we're going top down. A lot of times people will stick their chin out and their head will not be over their body, which again, I think is a result of sitting posture at a desk and looking at devices and things like that. And the thing we need to remember is that there's a couple things. Like if our head is not directly over our shoulders, then it causes us to lean because our whole body wants to follow that chin. And then if that happens, that's going to change what happens at the upper cervical spine. Upper cervical spine is really important when it comes to overall tension, neural tension in the body, right? So if someone has really tight hamstrings, I'm always looking at their head and their neck. If you think about a runner who has tight hamstrings and you can see it during their run gait, make sure you're looking at their head and their neck so that you can see like what's happening with that neck position. It also impacts your breathing. If your neck is not in the right place, then your glottis might be closed and you can't really get a good breath and get that good diaphragmatic breath, which if you've been listening to this podcast, is super important for core strength and stability, but also for downregulating your nervous system. So that neck position is a lot more important than we give it credit for, especially as runners. But the breathing is really important too. And that's really starting to become a bigger topic in our world. And I do think that if you're not looking at the head and neck and shoulders in a run gait analysis, then we're really doing ourselves a disservice because we're not addressing the breath the way that we could and the postural components the way we could. So I think you start there and then you go down to the shoulders and the arm swing, right? So arm swing is something that we can certainly manipulate, and we do manipulate a lot. I would say that's another high or one that's high on the list in terms of what we manipulate. When we're looking at an arm swing, we want to make sure that they're symmetrical, first of all. So what's happening on the left side should be happening on the right side. Making sure people are not really holding tightly onto their fists, like their hands are a little bit relaxed. And then their elbows are moving backwards and forwards so that their hand is coming up to the level of their heart and then back to the level of their pocket. What happens a lot of times is one of their arms or both of them will come across their body. So it's almost like they're trying to punch across their body or stir a pot or something like that. And so then they never really get into that posterior or back plane of their body. So that elbow is not going back. So again, if we think about our arms and our legs being a linkage system, one of our arms is going across the body and it's not going backwards. That's going to change how the legs are moving, how extension is happening at the hips. So arms are really important. when it comes to how your foot lands on the ground. We will be able to look at thoracic mobility and spine mobility when we're looking at the arms and how we're moving. And a lot of times, thoracic spine can be very tight in runners, and it impacts posture, it impacts breath, it impacts arm swing, and it impacts hip extension. And again, how the foot lands on the ground.
The other thing we look at the head as well is vertical displacement. How much is the runner moving up and down? That can give us an idea of where's because usually there's a few reasons why someone might have a lot of vertical displacement, or where you see like their head moving up and down a lot. One common one I see is they're pushing off a lot with their calves. So they're not getting a ton of glute activation. So they're pushing up instead of forward. And that could also be affected by, how are you leaning? So if someone's leaning more back, they're moving up more than forward. So that's another thing sometimes we'll look at, and what we can correct through some cueing as well. And then, of course, I obviously agree with everything. There's nothing I disagree with, but one connection I wanted to make for people at home is the arm swing and thoracic spine, right? So thoracic spine is sort of that middle portion of your spine. So from the base of your neck to where your lower back starts, or the end of your ribs. So think about all the places where you have ribs is your thoracic spine. A lot of the muscles that are attached to the thoracic spine are attached to the shoulder blades or the scapulas, which affect your shoulder movement. The reason why we might see someone's arms be doing certain things, it could be thoracic spine stiffness. So if you can't move through the thoracic spine and those muscles are tight and you are kind of getting around some tightness, and that's why we're seeing that movement. But it could also be a balance issue too. Sometimes we'll see the arms try to do things that the legs can't. That's where we have to make that arm and leg linkage connection there. So hopefully that helps tie it together a little bit. It's a muscular connection between the primary driver of shoulder movement and the thoracic spine. And that's why it's important.
Moving down from the thoracic spine and the arm swing, now we start to look at the hips. And this is where a lot of stuff happens. And this is where a lot of people who are just starting out with gait analysis really focus a lot of their energy is the hips and the knees. And the reason is because a lot of running injuries happen there. And it's really pretty obvious to see. So the things that we're talking about in the head, the neck, the shoulders, and the arms are things that a lot of people don't look at and maybe don't understand as well. But when it comes to the hips, hip drop is something that we see a lot. And so that's essentially, if you're looking at the top of the hips, one side will come down and the other one won't. So what we want is the hips to stay level throughout the run, regardless of what's happening in the feet. And we want to see stability there. I mean, there is like 10 degrees of hip drop normal within people, but you can't really see 10 degrees. So unless you really slow it down. So anyway, so hip drop is something that we look at. And then as we're coming down, we're looking at hip to knee, and we're looking at femoral internal rotation. So it's like, if you could see my hands, it would be much more helpful because I'm also talking with my hands and showing the movement. Unfortunately, you can't because it's a podcast, but
that's okay. I'll fill it in. Just keep talking.
Okay, good. The femurs, or the leg bone, the top leg bone, will turn in and kind of collapse in. And then after that, if you go down, you can see how the knees will dive in, or knee valgus. We can also have knee varus, which is going out. And usually people with like OA, a lot of older runners tend to have knee varus, which is really interesting. But that's when you'll see more like leg bowing and knees going out. And then as you go down from the knees, the next kind of set of bones is tibia and fibula, right before the foot and the ankle. And that also kind of internally and externally rotates. The knee, as it extends, there has to be some kind of rotation that happens at the femur and the tibia so that we can fully lock out. And then the rotation comes apart. So again, Kacy will probably fill it in a second. But so then there's some rotation there that we're looking for. And then we get down to the feet, which I think we'll talk about separately. So basically, the main things that people are looking at are hip drop, knee valgus or varus, femoral internal rotation, tibial internal external rotation. And then I totally didn't say hip extension, which is my favorite thing.
I know, I was shocked.
It's like always the first thing I look at, hip extension. And hip extension is how far the hip goes back in relationship to the leg, or how far the leg goes back in relationship to the hip. And so all of those things can impact, again, how your foot is landing and what's happening above that. So if we're lacking hip extension, for instance, we might be getting too much extension or bending backwards at the back. So a lot of people that have back pain will typically show up with some kind of hip extension deficit. And that's a really interesting thing. People with knee pain often have femoral internal rotation and knee valgus, or lack of tibial internal or external rotation.
Yeah, so hip drop is usually common knowledge for most of my patients. Before I even say anything, when they see it up on the screen, they're like, oh, look at that hip dropping. Yes, it's something we want to address. It's something I almost always will point out and talk about why that's happening. And usually that is because when we look at hip drop, right, we're seeing the pelvis is not level and it's dropping on one side, and it's going to drop on the opposite side of the foot that's on the ground. Because the role of our gluteus medius, as a lot of people know, and the role of our glutes, hip abductors, is to keep that pelvis level. So we know if that muscle isn't doing its job, then we're going to see this in running gait when we're going, progressing over that foot into mid stance, we're going to see that shift at the pelvis. This is where people are doing their clamshells and, Jane Fonda's exercises. I know Kate's covering up her eyes. I'm getting to it here in a second. So we need to train that in a standing position. We will practice keeping the pelvis level, doing a variety of standing exercises, whether that be a single leg deadlift, single leg squat, things like that. This is a topic for another podcast, but the key is here that we need to learn to control it in a standing position. So that's why you can't just say, I have hip drop and do clamshells. That was a little bit of a soapbox that I did not intend to get on, but it happens.
It always happens when clamshell comes up.
I know. I shouldn't have said
a whole episode on that.
I know. I shouldn't have said that word. And then in relation to hip extension, another thing that this might hit home for some people, two really common diagnoses like labral tears and sacral stress fractures or lumbar stress fractures. So if we're getting that extension through the lumbar spine instead of the hip itself, then we're going to compress those joints, and it can lead to issues in the sacrum and the lumbar spine. And then in relation to what we call like a capsular or a labral issue, if we're not using that entire range of hip mobility, we're constantly wearing on that same part of the acetabulum or the little socket of the ball and socket joint. And we can repetitively stress the labrum and can get some symptoms that may be labral in nature. The other thing we talked about, or everything Kate talked about, was femoral internal rotation, which is a big scientific word. The way I will talk to people about this is looking at where your kneecap is pointing, right? So if your kneecap is pointing inward instead of straight, like if you had a light on your kneecap, we would want the lights pointing straight forward, like headlights. And if they're diving inwards, that can tell us about what's happening at the femur or the thigh bone. That's usually... It's cliche, but that usually comes back to the glutes as well. And so I think the foot and ankle is our favorite. So let's move on to the foot and ankle.
All right. So the foot and ankle is really cool, of course, as is the rest of the body. But in terms of the foot and ankle, what we want, there's a couple of things we look at. We look at if there's enough dorsiflexion. So that's when you're bringing your toes up towards your nose, or plantar flexion, which is pointing your toes down. Okay. So we're looking at plantar flexion and dorsiflexion. We'll look at that on the gait analysis, but then we're also thinking about the joints that do that. Okay. So that's the talocrural joint. Then we're looking at pronation and supination, or inversion and eversion. Inversion, eversion happens at the subtalar joint, and inversion is collapsing in, eversion is kind of coming out. So like your toes are rolling up and in. So we're looking at plantar flexion, dorsiflexion, inversion, eversion, supination, and pronation. Supination and pronation are actually a combination of all the other movements. So we just need to realize that. So when someone says, oh, you're a supinator, or oh, you're a pronator, it actually takes into consideration whether you're inverting, everting, dorsiflexing, or plantar flexing. So, but we like to break it down into all the different things because that's how we know how to help you better. We're also looking at great toe extension. So the big toe, we're looking, can it extend? Can it flex? We're looking at the speed and quality of pronation. So everybody pronates, and you have to pronate. When your foot hits the ground, we have to have a rigid lever, and then we have to have the ability to accept force, which happens during pronation. And then we have to have a rigid lever to press off of. Okay. And so our foot moves through pronation to supination, and we have to be able to do that. But there's the quality and the way in which we do that is important. So sometimes people will be fast pronators. So it'll be a quick pronation. And if it's too quick, it'll really load that posterior tibialis tendon very quickly. And that can cause a lot of issues in the foot and the ankle. Sometimes people just overpronate and never come out of pronation, which again loads that medial or inside ankle, but also makes it really hard to press off, which often you'll see in the hip extension or inability to hip extend. Sometimes there'll be late pronation. So you will start to pronate far too late. And again, you may not fully get through that and you won't be able to absorb the force properly, but then you may not also be able to get into that rigid lever and push off appropriately. If you don't use your great toe, so sometimes we can tell by people's shoes, we can see a hole above their great toe if they're not pushing off of their great toe. But then also if you don't have enough great toe extension, then you can't push off of that toe either. So it could be motor control. It could be the fact that you don't have the mobility. It could also be proprioception or strength in the toes and the arch that could be affecting that. So there are a lot of things happening in the foot and the ankle. And oftentimes when we see these things happening, we can see them in your shoe, because in gait analysis, we also look at your shoes. We like to see the bottom, the inside, the sides, because that gives us another window into what's happening during your run. So we'll look at the shoe and see if there's anything there. And then we'll look at the foot. We'll see if you're able to move your toes individually. If you could see my hands are acting as toes. So move your toes individually. We would also like to see if you can use your arch, and if you can use your arch supporting your entire body weight, because those things will impact how you're landing as well.
Mm-hmm. Yeah. So pronation, I feel like gets a really bad rap. I think that it's like a bad word in the running community. I've had people sit on my treatment table and they kind of downcast their eyes and they're like, I'm an overpronator. And they don't want to look at me in the eyes. This is really nuanced because everyone does pronate. Pronation is a very important part of running gait. It's how we absorb force. So if we don't pronate appropriately, we're putting a lot of increased force on our more harder tissues, right? So bone and ligaments, things like that, because our soft tissues aren't able to support us in that position. We're looking at not only the amount, but also how can we control it? And so the way I talk about this quite often is you have natural muscular systems that can support your arch. So they're like your natural orthotics. So we think about your posterior tibialis muscle, which is the muscle that's right around the inside of the ankle there. And Kate talked about that earlier as getting overstressed when you can't control pronation. So your posterior tibialis, and then also your foot intrinsics. So the little muscles that are inside the foot. And so those are the ones that we're looking at when we're asking you to make an arch, things like that. And the reason why the actual foot intrinsic muscles, they're very small muscles, but the reason why they're important is because if we overuse the extrinsic muscles, so the ones that originate in the calf, some of those muscles that have long tendons that go they span a long distance, we overuse those, then we're going to be more prone to injuring them. So that's where we'll see the great toe extension, like Kate was talking about. So if you can't get that toe down, you're going to end up with, foot pain on the top of your foot, for example. Or if you're scrunching your toes, right, you're using your long toe flexors instead of your short toe flexors, which are in the foot. And so this is why we recommend a lot of exercises barefoot to work on these things. It's unfortunately with pronation, there's not a ton we can do in the way of cueing. Sometimes some of the cues can naturally help pronation just based on how it changes how the foot lands, how it changes the rest of the body. So I'm not going to say that we can't impact pronation through cueing and things like that. But the big thing here is strength and being able to control it, practicing control, really using the foot the way it's meant to be used. And I'm really excited because this is something I've been working on with myself a lot because I do have an issue with both of my big toes. Long story short, my left foot is just never going to behave like a normal left foot should. So I've been working really hard on it and I've been able to make some change. I'm happy to report that it has been getting better. I can tell my patients with confidence that you can work on it and it can improve.
And this is what she does when she's not working. And that's what she does when I find her in the clinic. It's really cool working on the foot and ankle strength, but it's true. It's really important and it does help. So, okay, so I think that's a pretty extensive wrap on what a gait analysis is and what we're kind of looking at. But I think the last thing to say is, there are a lot of different things you can use at home to help you manage some of the things that we've talked about. So in kind of your gait retraining, there's the cadence and the music and the metronome that we talked about. There's different shoe inserts you can use to track metrics about your gait. There's different watches we mentioned. There's foot pods. There's a lot of different tech out there. It's just the one thing we would say is that no one tech is too much. Some data is good. More data is not always good.
Right. Yeah. We want to keep things simple. We want to keep the joy in the sport. And I think a lot of these things are definitely useful and they have a place. Also, just, keep it as simple as possible. I think a little can go a long way with gait analysis and gait retraining.
Yeah. And again, never change more than one thing at a time because your entire body changes when you make one adaptation. If you start to try and do too many things, you'll take the joy out of it and you'll probably overdo it.
Mm-hmm. And it's less efficient for you in the beginning. So you might be a little more tired. So just set expectations for maybe some fatigue that's not really related to fitness per se.
That's right. You never want to do a gait change or a retraining right before a major race. You always want to do it, after that race is over and you have some time because you certainly will be tired. People always complain about being tired when they first change their gait. So Awesome. All right. Well, that was great, Case.
Yeah, that was awesome. I hope everyone enjoyed that as much as we did. We've been having a really good time.
I'm nerding out.
Yeah.
But yeah, of course, as always, if you have questions, please reach out to us. And we do virtual gait analysis as well as gait analysis in the clinic. And everybody in Precision Performance is trained in gait analysis. And it's extensive training because we're super nerdy and we want to make sure that everybody has a good experience. So thank you so much for joining us today. We hope that it resonated with you and that you learned something. If you enjoyed this podcast, please rate and leave us a review wherever you get your podcasts. It really helps increase our visibility within the platform so that more awesome people like you can find us.
If you'd like to support us further, pretty please, you can visit our Patreon page at patreon.com/morethanmiles. That's www.patreon.com/morethanmiles. Or for a few dollars, you can help the show grow and keep going, as well as receive exclusive perks like monthly Q&As with us. Until next time, remember to run the mile you're in, and that training is so much more than miles.